Both Miley Cyrus and Michael Buble have made headlines lately because of trouble with their heart. And we're not talking about a celebrity breakup.
No, heart problems actually can affect anyone, even young celebs. And in today's edition of Doc Hollywood, we sit down with Dr. Steve Smalley. He's a cardiologist at Regions Hospital to find out how you know your heart is taking a beating. Get it? See?
Got it.
And what you can do about it.
Zing.
I am here with Dr. Steve Smalley. Hi, Dr. Smalley. How
Hello.
you doing?
Good,
you are
thanks.
a cardiologist at
That's
Regions
correct.
Hospital. So it's very appropriate that we're going to start with this idea of holiday heart syndrome. Kind of sounds like maybe you got dumped or had a bad breakup, but we're talking about Michael Buble. He noticed that his heart was beating abnormally. Last week he went to his doctor and his doctor said holiday heart syndrome. What is that?
Holiday heart syndrome is when you get into a little too much alcohol. So alcohol causes dehydration and it can cause direct toxicity to the heart itself.
Wow.
So what happens is your heart goes into an irregular rhythm, most commonly something called atrial fibrillation. The good news is it's relatively rare, goes away usually within 24 hours, but in rare instances causes strokes. And some people it actually can be just moderate intake. So for the right person, 1 or 2 drinks might be enough. You don't have to overdo necessarily to get it.
Take it easy on the cocktails, huh?
Yes, right.
Now we got to talk about Frankie Muniz. He's 27 years old, so very young. You might remember him as Malcolm on TV from Malcolm in the Middle. He suffered a mini stroke last week. So let's talk about mini strokes or strokes and heart attacks and how they might be related.
They are related. And basically, stroke or heart attack comes from a lack of blood flow to a vital organ, either your brain or your heart. So if you think about it, an artery is like a pipe, and the blood flows through the pipe. What happens with either one is that a blood clot plugs the pipe, so you can't get enough blood flow to the brain or to the heart, and that's where you get the injury. So we call it brain attack if it's a stroke, or a heart attack if it's the heart.
So 27 seems really young for that.
It is young for that. It's young for a stroke, and the thing to remember is even though you're young, you can have a stroke or heart attack. So the average age for heart attack, for example, is 66 in a man or 70 for a woman, but it can happen in 20 or 30-year-olds. Same way with stroke. Usually occurs later, but can occur when you're young.
Any symptoms for a stroke that you should be really looking out for?
Symptoms you'd be looking for would be such things as slurred speech or loss of muscle tone or weakness in an arm, or perhaps loss of vision on one side.
What about a heart attack?
A heart attack might be a little bit different for a man or woman. Typically, you think of chest pain or pressure, could go down the arm or in the jaw. Women also might just have fatigue, shortness of breath, pain in the back. So those important differences there.
Another young star to talk about, that's Miley Cyrus, and she says she has a heart condition that causes her heart to beat a little faster than normal, something called tachycardia.
Tachycardia.
Are you impressed that I pronounced that?
I'm very impressed that you pronounced that right. And basically, tachycardia is where the heart starts racing all of a sudden. And for many people, it's just a nuisance. They get a feeling of fluttering or what we call palpitations in their chest. But other people will have more serious symptoms like shortness of breath, dizziness, perhaps even passing out. The good news is there's almost always a treatment for this. So if people experience that, they just need to let their doctors know.
What causes that?
Usually you're born with some abnormality in the heart. There's a problem with the way the electrical system is put together, so to speak. So boom, all of a sudden you get an extra beat that fires off at the right time, and it can trigger a circuit in the heart that causes your heart to race.
Well, now we got to put you on the spot, Dr. Smalley, because you're a cardiologist. So what kind of things are you doing to make sure that your heart is in tip-top shape?
I do the same things I tell my patients to do. I know what my blood pressure, my cholesterol are. Don't smoke, fruits and vegetables, and exercise on a regular basis. So it's as simple as that.
Pretty simple. Good advice. You're walking the talk. That's a good way to go.
Thank you.
Thank you so much.
Real serious stuff this week, huh? Strokes and heart attacks.
Yeah.
Scary stuff.
Well, it's just important to be aware of it. I mean,
Absolutely.
The more aware you are, the more you can take care of things if something is looking like it might not be right. And you want to head to TwinCitiesLive.com to vote for next week's Doc Hollywood topic. Just click on Only on TCL. Thanks to Health Partners Clinics and Regions Hospital for sponsoring the show. And again, you got to make sure that you check with your physician if you have a health concern. Kind of get those little symptoms in the back of your mind.